Welcome back to the morning drill. Joining us this morning, our friends from Titusville Area Hospital, Holli and Wolfe, Dr. Sonnenberg. Good morning, guys. How are you?
Good morning.
Happy Wednesday. Well, there's a lot to discuss, Holli.
Yeah.
Dr. Sonnenberg's got some great topics this morning. We're going to be talking about migraines.
Yeah.
Doc, all this rain causing migraines for anybody?
You bet it is. Changing weather is one of the big causes of migraine, actually.
I know sinuses.
Well, we'll get into that.
Okay,
Yeah.
awesome.
Okay.
Yes.
Going to start off with that picture of Van Gogh's Starry Night. I always like to start. I really like the subject of migraine. I really get into it. When a patient comes with headache, it actually kind of excites me because I know there's a lot to do with it. I like to look at the influence that migraine has actually had on art. And I think if you look at the painting Starry Night, that shows a lot of the effect of migraine. Van Gogh had a lot of issues. And one of the issues was he was a migrainer. In fact, he was institutionalized for migraine. And while he was in one of these institutes in France, he painted the painting Starry Night. And if you look at Starry Night, you can actually see the influence of migraine. If you ever had a migraine, if you ever had an aura, the wavy lines and stuff like that, the warning that the headache is going to come on, it's not just blurry vision, but it's waving lines. You get these flashing lights. You get these things that look like the tops of a fort called fortification. And you can see the influence that migraine actually had on Van Gogh's artwork. I'd like to talk about a few things. Number one, I'm going to shock people. There is no such thing as a sinus headache. That term should be discarded. We're the only country in the world that uses that term.
Really?
Wow.
Number two, headache is not a sign of a brain tumor. Number three, we should be doing less scanning, less testing, less MRIs for migraine. And number four, there's actually some new exciting treatments out there for migraine. But getting back to migraine, if I were the dumbest physician in the world, and I would call every headache that comes into the office a migraine, I would be correct 94% of the time.
Really?
94% of the migraine of the headaches that come to the office are migraine. And again, if I were an idiot, but I didn't call any headache that anyone had a brain tumor, I would be wrong one time out of 250,000.
Wow.
Headache is not a sign of a brain tumor. People with brain tumors get the same number of headaches as the regular population. There's other signs of a brain tumor, there's other signs to worry about, but headache is not one of them. Migraine actually is a Greek word for half a head. And 60% of the migraines involve half the head, one side or the other. A migrainer will have a favorite side. They'll have one side or the other. But usually these headaches are throbbing in nature. They're usually one-sided. They're worsened with motion, and they're fairly severe in intensity. These are the headaches that bring people to the office, not the tension headache that's easily controlled with Tylenol. The migraine is what brings you to the office. Migraine is very common. It's hard to make it through life without getting a migraine. 95% of us are going to have a headache sometime in their life, and usually it is migraine. It's more common than diabetes. It's more common than asthma. Roughly 25% of women get it, 12% of men will get it at the same time. People tend to have negative feelings about people with migraine, but actually if you look, there's a certain migraine personality. The people with migraines tend to be conscientious. They tend to be obsessed with achievement. They are tuned to the feelings of others. They put others' feelings first, and they really believe that hard work pays off. These are the people that are motivated. And there's something to go along with that. There's a theory that migraine is not just a silly reaction of the body, that it actually has had an advantage in caveman times, that the people with migraine had the hyped up sensory system. They saw more light, they felt more, they smelled more. And in a quiet caveman world, that was actually adaptive. In today's society, noise, you can't get away from lights, you can't get away from sound.
Yeah.
These people have these sensitive brains that are easily set off, and that's one of the theories. Going back to what's...
I'm going to get rid of my kids now.
Yeah.
Going back to what sets off
These
a
bright
migraine.
lights in here. I'm going to leave today.
The biggest thing that sets off a migraine is actually stress. But people don't get migraines during the period of stress. They get the migraine when the stress goes away.
I was just going to say,
wow.
When the stress let down.
when I'm stressed,
Yeah.
it doesn't come on. But after I feel
The
like I
stress
dealt with
letdown.
it, then it's
stress
like,
letdown.
Yeah.
boom.
Yeah.
The second one, and I guess this has probably nothing to do with Men's Health Month, is menstruation. Menstruation will set off a migraine. Usually it's about 2 or 3 days before the period has begun. There's other things too.
And I'm being very serious when I ask
Yeah.
you this. Do men have symptoms like women? I mean, not the
No, they don't.
okay. All right.
But men do get migraines.
I mean, they don't get like moody or, I mean, there's,
No.
okay.
Well, okay, change the subject. There is something called a prodrome. A day or two before a headache's going to occur, there is a prodrome. And sometimes you feel something like they yawn a lot, or some people just rub their neck
Yeah.
in the back. They get a little more obsessed with getting things done. This is the prodrome. There's oftentimes a prodrome to a migraine. So that can hit both sexes. But as far as the monthly thing, that's kind of unique.
Okay.
Strong odors can set it off. Sleeping in or
Really?
weather changes is big. People get obsessed, well, what food sets off a migraine? No, there's really no food that sets off a migraine, but there's a pattern of eating. Don't skip meals. That'll set it off.
I was going to say, if you don't eat,
Yeah.
can that...
That can set off a migraine.
Yeah.
Like, I found a combination for me is like, if I don't eat and maybe lack of sleep.
Yeah.
So you're saying too much sleep or too little sleep?
Too little sleep. What the migrainer likes is things the same. They don't like change. They don't like their hormones change. They don't like the weather change. They don't like the stress change. They don't like their meal pattern change. Go to bed at the same time, wake up at the same time. Consistency, lifestyle really helps. There's certain common theme to this because these people have a hyped up, overactive sensory system. It's set off easily.
And you hear that sometimes, especially like the time change, where
Yeah.
people
Oh, yeah.
have issues with that.
Yeah.
Yeah.
I mean, so think of a classic. Think of the college student. They're studying for the final. They get the final done on Friday. They go out and they party a bit. They sleep in. They skip breakfast. They're going to get a migraine. And they live in Northwest Pennsylvania with weather changes.
Yeah.
Yeah.
I mean, you just really think. But like I said before, everyone thinks, oh, I have a headache. Must be a brain tumor. Get me in a CAT scan or get me in an MRI. Really, like I said before, a person with brain tumor is no more likely to have a headache than a person without brain tumor. There's other signs of a brain tumor. So, when do you really worry? When is it something else besides a migraine? Well, the classic is the first headache after the age of 50. You aren't supposed to live to age 50, then after 50 get your first headache in your life. Something's going on. First headache after the age of 50. A new or worse headache. Okay, I'm used to this particular headaches, but now it's changed. Something could be wrong. A headache that occurs with exertion, sex, coughing, or sneezing. If they have something neurologic. Oh, if I have a headache, oh, by the way, my left side of my face is drooping.
Yeah.
That could be something else. Or if the vital signs are abnormal, if they have a fever, if they're immune suppressed and have a headache, you worry about that. Getting back to the sinus headache, this is ridiculous. There is no such thing as a sinus headache, or at least none. There was a study done in Seattle in 1980 where they looked at 2,524 people who knew they had sinus headaches. Docs, I have sinus headaches. They did a study of those people. Those who really had a headache caused by their sinuses were 4.
Wow.
If you think you have a sinus headache, there's a 99% chance you're wrong. Now, it's not to say your sinuses don't hurt. The migraine involves the trigeminal nerve. Trigeminal nerve gives sensitivity to the sinuses. So during a migraine, your sinuses hurt, but it's not the sinuses causing the headache. And the other thing that confuses people is 50% of the time when you're having a migraine, your nose runs, your eyes run. So you get this headache, pain over your sinuses, your nose is running. I know it's a sinusitis. They run off, they get their Zithromax, and it's gone in 3 days. No. That's not a sinus headache. Nowhere else in the world do they believe in such a thing, but it's kind of unique to the United States.
So when they're running to the store to get sinus medication, what's happening? Is it even doing anything?
Well, actually, a decongestant is slightly helpful in migraine. It's slightly helpful. So they're kind of doing something, but they're not doing the right thing. They're not addressing the real problem. Sinuses can occasionally get painful, but it's usually it's after a cold. They've had a snotty nose for 10 days. They gradually get this onset of pain. It's a gradual onset. You don't wake up, go to sleep, you sleep at night, wake up in the morning and say, oh, I have a sinus headache. I got to get an antibiotic. No, that's not from a sinus infection. That is in all likelihood migraine. And I go back to that Seattle study where it shows it. So that's another myth I'd like to actually get away with. So the other suggestion is, how do I avoid migraines? Well, first off, find the right mother and dad, because migraine is highly hereditary.
Wow, I didn't know that.
I get migraines. My wife gets migraine. All three of my children get migraine. You know, it does run in family.
Sure.
So I like to actually look up the positive aspects of migraine. But one of the main things to do is, you know, lifestyle changes.
Paint.
Yeah.
Yeah.
Try to avoid stress.
Relax.
Try to avoid weather changes. Try to avoid parents who have a history of migraine. Well, okay, that's ridiculous. Those three are ridiculous. But the thing is, like I said, the
Living in
migrainer
Man's
likes a regular pattern. Go to bed at the same time. Wake up at the time. Don't indulge yourself by sleeping in. Get the right amount of sleep, 7 to 8 hours. Regular meals. Don't skip meals. Don't worry about a particular food. Don't worry about the HGs or stuff like that. Just don't skip meals. Get regular exercise. Try to cut down your stress, you know, and adopt a healthy lifestyle, because migraineurs have more sensitive brains. It's easy to set off. So anyways, migraine has to be taken seriously, because if it's not treated properly, there's a concept in all of neurology called kindling. If you don't address a pain gets worse. So it's got to be taken seriously. The worst thing you can do, for example, a kid that has migraine in school, the worst thing that can happen is, okay, you have a headache, go into the nurse's office, lie down for an hour or two. No, that's the wrong thing. The headache will get worse. You got to jump on it. You got to give a migraine-appropriate medication to get it early, because in the first 6 hours of migraine, treatment is easy. The medicines that we usually use for migraine, the triptans, have a 94% efficacy. They work very well. They work quickly. Generally, they take care of the pain in 15 minutes. They take care of the nausea in 30, if you use it early. But if you wait after 6 hours, the migraine becomes ingrained. There's something called, it's a technical term, it's called cutaneous allodynia. But the best way to think of it is the hair hurts. After 6 hours, you start getting depressed, you start getting weak, and you start getting sensitive. Things that should not hurt start hurting. It hurts when I comb my hair. Combing the hair should not be painful. When you get to that point, the success rate of the triptans dropped to 6%.
Wow.
Get it early. There was a family practitioner who's actually considered a worldwide migraine expert, a guy by the name of Katie, and he did studies with all of these medications used for migraine. And he found out the people who cheated, who used the medication before they were supposed to, at the first sign, rather than wait till we're really sure it was a migraine, they actually had a higher success rate and they had less side effects. Get the migraine early in the first 6 hours.
So if you feel something's coming on,
Deal with it, yeah.
So what are the symptoms? I mean, what's the major symptoms?
Let's do this real quick. You're watching The Morning Drill on Stream Television in Armstrong and listening to it on the Allegheny News Talk Sports Network.
The symptoms of a migraine. First off, you got to look at the typical age of a migraine. It can probably hit at any stage of life, but usually it starts off as a teenager and stuff like that. You look at the typical pattern. Usually a migraine is unilateral, on one side or the other. A typical migraine person will have a favorite side. Sometimes it can happen on the other side, but usually it's on one side. But it doesn't have to be one-sided. 40% of migraines are actually both sides. So you don't go by this. And a migraine does not just involve the head. A lot of people, 40% of the people, they get the migraine back here. It starts in the base of the neck and moves slowly up. So it's unilateral, it's throbbing in nature. And the other thing that's very characteristic of migraine is when they have the migraine, they want things quiet. They want it quiet. They don't want lights. They don't want to be touched. They don't want to smell anything. It's all up. So they want to lie in a quiet room quietly. There's another type of headache that hits males. I don't know if you ever heard of it, called the cluster headache. Cluster headache is slightly different. It hits males. It usually hits in the morning. It lasts 20 minutes. And it's been described as the worst pain that ever can hit a human being. It lasts for 20 minutes. These people will walk around, bang their heads against the wall, and it's not unknown for these people to take a drill and try to drill a hole in their head to get rid of the headache.
Really?
This is the worst pain that can be serious. So, how is it a migraine? Is it a cluster headache? Well, are they quiet in their bedroom, or are they walking around banging their head against the wall? Yeah. That's a good thing. Migraine is associated with nausea. The other interesting thing, too, is that some migraines have an aura. An aura occurs before the migraine. It's usually one of the more precisely timed things in neurology. It usually lasts about 20 minutes. And it starts off with the visual disturbance. I've gotten auras occasionally in my life, and it's kind of an interesting thing. Mine kind of resembles a Japanese fan.
Huh.
I kind of get
Really?
this Japanese fan that slowly starts in the peripheral of my vision and slowly moves inwards. And it has jaggedy lines. It's very colorful. It's kind of neat, except I can't read a thing.
So is it
when
on
I'm having
one side or the other,
Usually.
or is it, yeah?
But it's usually 20 minutes. 20 minutes you have the aura, then you get the migraine. And there's a lot of interesting stuff that goes on to it. There was a famous neurologist by the name of Wolfe, and this was in the days before the CAT scan, before the MRI. And what he did is he said he knew his anatomy of his brain really well, and he actually calculated that the aura is caused by a wave that goes across the back part of the brain, and it moves across the back part of your brain at 3 millimeters a minute. He calculated that based on his knowledge of anatomy. Later, with the MRI, this was actually proven, but it's a gradual onset. So if something bad happens to your vision, is it a stroke or is it an MRI? Well, it's kind of easy. With the stroke, it happens quickly. Your vision's gone. With the aura of a migraine, it just comes on slowly, very slowly, evolves over 20 minutes. Then you get that. And it's not just blurry vision. There, like I said, there's jaggy lines, there's fortifications, there's colorful lights and stuff like that, and you end up painting a painting like Van Gogh did with Starry Night.
Yeah.
So, if somebody feels the onset, these symptoms,
Treat it early.
Tylenol, Excedrin, none of that works? Does it work?
Tylenol is pretty actually kind of poor for migraine. Migraine is actually a form of sterile inflammation. It is inflammation of the blood vessel, so you really should do something inflammatory. If you're going to go over the counter, go to something like ibuprofen and use it early. But that works for some. But the really good medications are triptan. These came out about 25 years ago, and believe me, when it came out 25 years ago, it made treating migraine fun. Before that was annoying because you had this medication, and the first time you gave it to people, they were actually stunned at how well it worked.
But that's through a doctor?
Yeah, it's a prescription through a doctor.
Okay.
These medications have side effects, but they're very safe. You get sometimes a tingling and stuff like that. Don't worry about it. The chance of something bad happen is about 1 in a million. One lecture I saw said the risk of having something bad happen to you after taking a triptan is the same as having a jet engine drop on you from the sky. They're pretty darn safe, but they work, and they work better when they used it early. So I think the triptans have really made treating migraine, from a annoyance to actually being fun.
Great information, Doc.
There's medications that you can take that prevent a migraine. They don't treat a migraine when you're having it, but if you get a lot of migraines and you treat it regularly, you can take these medications. For example, the blood pressure medications, the beta blockers help it. So when someone comes in with high blood pressure and migraine, it's wonderful. I could give them a reasonably priced medication. It takes care of their blood pressure and lessens their migraine. The other one I like is actually it started life as a seizure drug, Topamax. I think it works particularly well in women because it treats migraine fairly well, and it has this side effect, darn it, of weight loss.
Oh, darn.
Darn, weight loss. It has some interesting side effects. It gives people the tingles sometimes. They have trouble with word searching, and they also develop an aversion to carbonated beverages, but it's still kind of interesting.
Yeah. Hey, Doc, great to see you. Holly, we'll have to have you back.
Yeah.
There's some other information to present, but great to see you guys. And again, some wonderful information there.